Okay, good afternoon, everyone. We're here today for our discussion on chronic diseases and mental health. I think first we'd like to just know who everybody is. So my name is Dr. Njeri. I'm a medical doctor. I work with HealthX Africa.
Thank you, Dr. Njeri. Welcome our online viewers to this session. My name is Sylvia Okwara, and I'm a clinical psychologist. Welcome.
So today, as we mentioned, today we're just going to talk a little bit about chronic diseases. And I think it's very important for everyone to know when we talk about chronic diseases, what exactly do we mean? So normally there are different definitions. So a chronic disease is any condition or disease that you need management for a prolonged period of time. Can be 3 months, can be 1 year and above. And normally it has an impact because you need continuous medical care, and it has an impact on your daily life. So this can be different abilities as well. And then it also has an impact. It can also be both. You can need medication, and it also has an impact on your daily life. But normally we have the common ones that we normally know, like hypertension, we have diabetes, but we have those ones that people do not know are chronic conditions. Things like arthritis. Arthritis is very common. We also have like back pain. It's very common. It's a symptom, but it can also be a condition that is very chronic and persistent. We also have things like endometriosis. It's a chronic condition, has impacts on our abilities. We're on medication for a chronic period of time. We have cardiovascular diseases as well. This could be coronary artery disease. This one is where your heart vessels are impacted. They can be having atherosclerosis, and then this can need you to be admitted. We also have stroke. It's also a cardiovascular disease. We also have heart failure, where your heart is just not functioning as it should be. And also other chronic conditions that we can also be having is things that normally impact us, like mental health conditions. They're also chronic diseases, but are not considered chronic diseases sometimes. So I think for today's discussion, we have quite a bit of things to talk about. So mental health conditions with things like anxiety, depression, they are chronic, and they also need constant medication sometimes. They need constant follow-up, and they also have an impact on our daily lives as well. Sylvia, how has been do you consider anxiety and depression part of chronic diseases?
Yes, because they also take some time to treat them or even to manage them. Yeah, so some of the mental health conditions are also chronic. Yeah, and you find that they are comorbid with some of these physical chronic illness that you have actually mentioned. Research indicates that there's no way you can guarantee physical health without mental health. And the relationship between mental health and chronic illness is bidirectional, meaning one affects the other.
Yeah.
So when you have a chronic illness, the chances of you developing mental problem is quite high. In fact, people who have chronic illness, you find that the chances of them having depression and anxiety is quite high compared to the general population. And people also with maybe depression, bipolar, also have a high chance of developing chronic illness. And therefore, now when it comes to management, then it's important that we involve the multidisciplinary team so that our clients or our patients are able to manage whatever that they have. Yeah, so when it comes to chronic illness, just as you've mentioned, Doc, it's not something that is easy. It's not an easy information to process.
Yes, very true.
And I think even in hospital setup or any clinical setup, it's important when we realize that someone has a chronic illness, that a psychologist is involved also to help them understand what it means to have a chronic illness.
Yeah.
Because without understanding, then you find that even management can become tricky. Yeah, I don't know. I think it's a good practice when also, it's like breaking news, when you are told that now you have diabetes and maybe you might need to live with this condition for quite some time, because it means that even things might change. Maybe you might need to be taking some medication for quite some time. So you find that also preparation becomes very important to ensure that there's smooth prognosis of the client's condition.
Yeah, I think it's very, very important to have that multidisciplinary approach, especially for, I know some programs may have it already incorporated, but I think for the majority of the cases you find you get the diagnosis, you have a very short time to process, and then you are given the medication and you're told this is what you need to do, this is what you need to do, and then you get stuck because now you are still processing everything. You're going through like the different stages of acceptance. Before you get to acceptance, you've gone through, you know, your sadness, you're grieving. But I think also you've mentioned a very key aspect in terms of what health exactly means, because health is not just being the absence of disease. You need to be physically healthy, you need to be mentally healthy, and you also need to be emotionally healthy. So I think that also needs to come into the aspect of chronic disease management, to also incorporate in terms from diagnosis, you know, working with the client so that they can be able to accept the impact it has, because I know it has an impact. We focus a lot on the financial impact in terms of paying for the medication, you know what you need to do, the visits to the doctor. But I think sometimes we tend to forget the psychological aspect of the patient. And I think this is where you guys come in terms of helping them understand, you know, this is just a slight shift. You need to just basically reach to acceptance, because if you don't accept your condition, then it'll be very hard to know, like, you're supposed to take medication every single day. You know, you're supposed to be changing how you are living your life. And some conditions you find there's an aspect of you need to stop some of the risk behaviors that we have, like something like cigarette smoking. It's something that's very difficult to stop, but it's a very big risk factor for a lot of these chronic conditions that we do have. They know, like asthma, COPD, chronic obstructive pulmonary disease. It's a risk factor for hypertension, diabetes, majority of the cancers as well. It's a very big risk factor. But now we're telling somebody, you know, they've come to the doctor, I tell them, you know what, you need to stop smoking. Then you let them go. So you see, they need a lot of psychological support. And I think this is where you guys usually really come in and really help a lot, from diagnosis all the way through management, just walking along the journey for the patients. So I think maybe, Sylvia, in your experience, with these patients who have chronic disease, other than the ones who have mental health conditions, how do you walk along with them along this journey so that they can, you know, be able to accept a lot of these things?
Yeah. Thank you for that question. Yeah, so it's important that when someone has a chronic illness, that they are supported in that process, because without support, it can become a bit difficult. So maybe before I get into that, maybe just to highlight a few emotional reactions that normally comes with chronic illness, because again, we normally support our clients, our patients based on that. So when someone has been diagnosed with a chronic illness, they might experience different emotional reaction. And one of which, you know, you mentioned, you know, someone might be in denial, you know, shock, you know, how comes that it's me? And you see that denial can actually make them not to do what? To start treatment. And you see now, even in terms of support, we need now to come in and help them to see how they can be able to do what? To accept. But it is not just something that you can be able to do in a day. So, but you see now that aspect of denial, it's common. We understand that it's a normal reaction when someone has actually gotten that kind of information. For some, it's anger. You know, they get angry. And I've worked with people who have chronic illness, and some of them, you'll find that they'll have some sort of irritability. You know, they're sometimes angry even with their caregivers, and sometimes the caregivers call us and it's like, this patient is not cooperating. So you find that there's a lot of anger, because again, there's a lot that they are dealing with. Yeah, so for us, even as psychologists, we need also to come in and also just try to help them see how we can be able to support that, because again, we understand that it's a normal emotional reaction to whatever that they are going through. So they might be angry, maybe you know, because of themselves, or maybe because, you know, angry at God, or you know, angry with what, so many things, depending also with the nature of chronic illness. Like for instance, maybe if someone maybe has HIV and they realize that maybe it's their partner, you know, who, you know, brought the HIV, you know, they might be angry at their partner. So you see now, this is somebody you need, first of all, to manage that anger, so that the person now can also be able to do what? To adhere to their medication. Some of them might be in a state of bargaining, you know, why me, why not other people? You know, I have been very, you know, very diligent in what I do. Why is it that, you know, I'm getting this? You know, I've been eating healthy, you know, I've been doing exercise. Why is it that now I'm getting what? Diabetes. So you find that, you know, all those emotional reactions sometimes can delay the start of treatment. Some can actually now get into a state of depression. You know, they don't want to see people. They just want to isolate. They just want to be on their own. And, you realize that all these things are, quite important. So for us as psychologists, we come in, first of all, to get to understand what the client is going through. Some are experiencing anxiety because, again, some of this chronic illness might mean death sentence to the client, not, because, again, of the information that is out there on the media. But again, if these people come and see the doctor and they're able to agree on the treatment plan, and also depending on the staging or where the problem is, then some of these things can be managed, and people can try and learn and see how they can be able to live just a fulfilling life. So for us as psychologists, we come in mostly to support the emotional aspect, because we know that really impact even the intake of the treatment or not. So it becomes very important. And also the family members, because we understand that when there's chronic illness in the family, it's not just about the person we seek. The whole family is affected, and therefore it becomes important also to just have a sit down with the family members and see how they can be able to support the client, because again, other things might be needed, like finances, adjustment might be needed, and that support also becomes very important, especially when people are prepared.
Well, I think you've brought in a very important aspect of, the social aspect, because we are all social beings. And I think a lot of time in healthcare, we tend to focus a lot on the biomedical. Like, this is what I have, this is the medication I need to take. Forgetting, we are going back home to a family, you're going back maybe to a spouse, you have children you're supposed to take care of, or maybe it's your child who's unwell and you're wondering, like, where did I fail this child? So there's really a lot of aspects of the family and the caregivers as a whole. And I remember also caregivers can also have a toll on their own emotional health, because, you're taking care of somebody else, your loved one is unwell. There's also that acceptance for the caregivers as well. And I think a lot of things which I think I liked from the HIV programs was the aspect of, having support groups for these people. You're newly diagnosed, you have a support group of other people who are walking along the journey with you. Same thing I think I've also seen with patients who are having cancer treatment. You may be having, the doctor is explaining to you, like, you have your diagnosis, they're explaining to you, they're giving you the information, but you may not be at a point where you're able to absorb this information at the initial point. So it needs to be, I think, a continuous journey of the support and working with them throughout. But you also see patients who, like, yes, they did accept, like they've accepted, or rather we perceive they've accepted. And as we walk along the journey, you realize as you're going through treatment, because sometimes some of these conditions, they will require one of the hardest aspects in medical care, which is behavior change. So you find, like, you learn to live a certain way in terms of your eating habits instead of your lifestyle. And suddenly, your healthcare team is coming to tell you, so you need to exercise X amount of times. You need to, like, stop taking alcohol or reduce the alcohol you're taking. You need to stop smoking cigarettes. You need to start eating a certain way. So that aspect of behavior change, I find that sometimes we also need the psychologists to also come in and also support us a bit, and also support the clients as you're working with them through the behavior change, just to at least be able. But also we find the patients who you started treatment, but suddenly you kind of can also regress, because also our feelings are valid. What you're feeling is technical, is very, very valid. So you can find that maybe you had accepted, you reach a certain point, you just a snag in your treatment, maybe a complication comes in, maybe you find you had not reached the biochemical markers you're supposed to. Maybe if you're diabetic, you're supposed to reach a certain level in your blood sugar control. You're not there yet. So then also anger can still come in. Shame can also come in as well. So I think walking along the journey is very, very important as well for these patients. And also, as you mentioned, for their caregivers. But I think also another aspect you brought in is look at the patient holistically, meeting them at their point of need. Because you may think as a healthcare worker, so I think they need support maybe in accepting the diagnosis, but maybe they have already seen maybe their parent had this condition and their acceptance is a bit easier. But now walking along the journey towards the rest of the treatment becomes a bit of the challenges. But also now also for the chronic conditions that we tend to find that have a lot of stigma. How do you break to your family and your loved ones, like, I have been diagnosed with anxiety, I have a mental health condition, I have depression. How do you, because you need the support for your social support to get through that. How do you help our patients navigate some of those conditions that are, quote unquote, have a level of stigma carrying around it?
Yeah, and thank you, Doc, for that question, because some of this chronic illness, you find that the stigma around it. And for some people, they'll prefer just keeping it private. And as practitioners in mental health, we understand that it's okay to just keep confidential information about someone's health, and unless now they are willing. So what we do is we just also empower them, because again, a stigma could be because of misinformation.
Yes,
Yeah,
yes.
because again, there's misinformation out there about certain chronic illnesses. Like for instance, maybe if someone has HIV, one might think that it's because they have been engaging in, some sexual behaviors and what have you. But someone can also get HIV through blood. Maybe they were sick and, whatever gadgets that were used, maybe somehow they got, or maybe it was an accident.
Or they were born with it as well.
Yeah, or they were born with it. Yeah. So you find that sometimes the stigma can come because of misinformation. So one of the things that we normally do is we do a lot of psychoeducation. We do a lot of psychoeducation on some of these chronic illness, and we don't just do it alone, because again, with some of those physical chronic illness, we have to work with the doctors. So at least also working with the doctors, so that the doctors can actually give the correct information about the illness. And once we are able to let the client know what is needed or what this problem is all about, and just also letting them understand that it is okay to be vulnerable.
Yes.
Yeah, it's okay to be vulnerable. It's okay to be in a space where we are at our lowest and we require someone else to support us. That becomes very important. So a lot of psychoeducation is required. And maybe, Doc, I can also ask a question, especially now when it comes to chronic illness. We know there's the aspect of quality of life. And there's a way people measure quality of life, differently. I remember you mentioned about routine and what have you. And as psychologists, we believe that even quality of life is the general happiness,
Yes.
the happiness, like the fulfillment that, comes with life. So you find that somehow someone might be living life, but
they're not happy.
They're not happy. So I don't know, maybe how we can be able to improve quality of life, because again, there will be some change, because we talked about the changes that needs to take place. So how do we ensure that these people are still able to to be okay,
and live a fulfilling life despite your diagnosis,
despite whatever disability that might come with a chronic illness?
No, I think that's a very important aspect in terms of quality of life, because I think a lot of the focus tends to be more of treatment. But you find, I remember there was a study I had seen online in terms of looking in terms of patients who are having cancer. Yes, I may have cancer, but I may also have a partner. How is my sexual health going along? Am I able to wash myself? Am I able to do things that I can handle for myself? So I think it can also be individualized in terms of what makes you happy. What gives you fulfillment? Because you can find for everybody it's a bit different. For some people it might be their family. So you find that maybe the fact that they cannot take care of the family well enough is causing them a lot of anxiety and making them think, okay, I am not who I am, I'm not happy. But just finding ways that you can get the same fulfillment without it impacting what you can do. Do what you can, because everybody, I think, on this earth has a limit to where they can reach. Let's say maybe I'm in a wheelchair. With my wheelchair, can my wheelchair get me from point A to point B? Is there accessibility where I'm going to in terms of that? If I can do the small things for myself, I think I will be able to feel much happier. But also, happiness, I think, also is impacted by a lot of what we see on social media. So there's a lot of comparison we tend to see a lot. So making sure that people have groups or the support groups as well. So you can see people have the support groups, they have the support that they need, the social support that they need to see, this is where you need to be going with this is what being healthy looks like, because health looks different for different people. So finding that happiness within yourself, I think, is where we need to support the clients a bit more, our patients a bit more. But I think it needs also to be individualized. But also the aspect comes in, if I don't know what makes me happy, you really cannot help me find my happiness. So it really starts a lot of digging in and a lot of self-evaluation as well, and walking along the journey. And also where patient needs accommodation, I think this is where as a medical team we come in, because you may need accommodations at work, you may need accommodations at school. So that's where we come in and maybe support, let your employer know and let your school know, okay, they're going through this condition with your consent, of course. So can they get them maybe A, B, and C so they can be able to complete their journey? I think it's a whole holistic management along the way to be able to get these people to be happy. But also we find, as much as the people with chronic conditions who we are focusing on today, you do find that as a country, are we really happy as Kenyans? So I think there's a whole avenue around, a whole discussion around happiness that we need to be having on an ongoing basis as Kenyans, as people who are live in the healthcare space. But I think, yeah, the aspect of happiness is very important. But maybe another thing I'd also like to bring in is the aspect of control. A lot of us, we are happy, we are safe when we're able to control things. So now when it comes in and you're being given a diagnosis of maybe diabetes or HIV, that control is kind of taken away from you. So I think it's also important for the patient to be able to understand you're able to control your medication, you're able to control. So you focus on what you can control, and what you cannot control, you can't handle. So then now that also needs to come into the aspect of their treatment, because when you lose control, you become angry, you feel like they've taken away my health, this disease is taking away my ability to walk, it's causing me a lot of pain. So that aspect of control also, I think, needs to also be factored in as well, for our patients to be able to understand a lot about that.
Yeah, and thank you, Doc, for that. Another aspect that normally comes in, especially when people have chronic illness, is the issue of self-esteem. Because you find that with some chronic illness, it can really impact our physical well-being. And maybe in this case, maybe the treatment that is involved. Like if I can take an example of cancer treatment, the chemotherapy, you find that, it can impact the hair and what have you.
Yes.
And especially now for some ladies, or maybe if it is breast cancer, and you are told that one of the breasts need to be removed,
Or both.
Yeah, or both of them needs to be removed. So you find that now the aspect of self-esteem and identity can also come in handy. And as psychologists, it's one of the things that we also try to, work with the client so that they can be able now to just embrace the new identity, or they can be able to accept, what is happening. Because again, sometimes the changes that happens could be because of the treatment, or maybe the changes could also be because of the chronic illness. There are certain chronic illness that can even affect your skin, how you look. And for some people, you find that this can really impair their social life. Because again, you find that when it comes to functioning, we are looking at holistic functioning, even in terms of the social space. So you find that now if you're not able to relate with people, you're not able to, interact because of how you look and what have you, then that also becomes, something. So for us as psychologists, we try as much as possible, maybe just also to work with the client and see maybe for maybe if it is the cancer treatment, the issues of hair, are there certain things that they can do to just make them look comfortable? Maybe they can put on wig, or, or maybe just something that will just help them to just feel like they are comfortable. Or maybe if there are those other avenues, maybe plastic breast and what have you, just to make them look better. And of course, the most important thing is just accepting. But again, it's also a journey, because again, acceptance is also not easy, because again, remember, this is a new normal. It's not something that you're used to. There's this person, there's this Sylvia that you knew, but now, this Sylvia is looking different. And of course, just also embracing the new Sylvia is not easy. But now you see, just also ensuring that you are able to lead a fulfilling life is how you can be able to deal with that. Because again, that aspect of self-esteem and identity also brings about the depression. So you'll find that this person will actually be in depressive episode. Yeah. So even if we are giving them antidepressant, maybe the psychiatrist is able to prescribe that. But I think the most important thing is seeing how they can be able to do what, to accept that. And another thing that we normally do is we also conduct, support groups.
They're very important.
Yeah, support group. And if we can be able also to put this patient in a support group for people maybe who have been impacted the way they are, so that they can also be able to learn how has this person been surviving. I can see that they have really changed, but they look happy. They are living a fulfilling life. They are not hiding themselves in the
Yes.
house. So if they are able also to have that kind of a support network, then it becomes very, very important. So somehow, it can be normalized because they can be able to see that other people are also having
Living
the
this
same,
life.
they're having this, and they're still able to live a fulfilling life. So having a support group is also very important, and we have various support groups for people with cancers, people who have different chronic illness. So we normally encourage our patients also to just join those support groups. Those support groups can be online or also physical. Yeah, I know for some chronic illness, especially those that affect the mobility, so maybe online support group can really work. Yeah, but those who are also able to join the physical ones, then the
That can
better.
also be
Yeah, because
supportive.
again, that can also help them to ensure that they still have a support group, they still have a social life in one way or another, and their social life is not impaired in one way or another. So you find that it's a whole of, like, we have to look at it holistically.
Yes.
And when it comes to management of chronic illness, we normally apply the biopsychosocial model, where we look at the client from holistically, biologically, we are looking at the physical aspect, psychological and social, so that at least we ensure that we have some level of functioning in all aspects of their life.
No, I think there's also a very important aspect you brought, especially for the ladies, or maybe also the men who've been diagnosed with breast cancer, and then you have to go through like the mastectomy. I think there's also an aspect where for the medical team can come in and say, okay, so yes, we're taking away your breast, but there are options for you afterwards, because I know there's a way they can do what we call usually plastic and I've forgotten the second term. But usually plastic surgeons they give you options. Like, would you want us to put in a silicone implant, or do you want us maybe to move muscle from a different place and put it there as a breast tissue? So you have that aspect of control, because yes, you cannot control the fact that you're going to lose your breast, but you can get to control afterwards and how you're going to maybe look outside and also move around. I think also the support groups, I think it's really impactful. I know the HIV programs have very vibrant support groups, and it will help you like understand your diagnosis, make sure that people are living positively. But I think also we need like the champions, people who have these conditions and they're living with them. Because if I am living with HIV and then I have opted to do advocacy and walk around and show people I am living with this, I am proud, I have managed to overcome these barriers, then people have like someone to look forward to and look up to and see, okay, they have succeeded, then I can do this as well. I think that's also very important, to look at the patient holistically and manage every aspect of it all. Chronic diseases are also very different and very vast. So what works for one may not work for the other. For in terms of like patients or clients who are having like chronic diseases that impact their work. So let's say maybe I am having anxiety, I'm having depression, or maybe I'm having diabetes and it's affecting how I work. And so I am going to start going into a bit of a anxiety or depressive episode. I'm getting a bit stressed. Stress is also a very big impact of how these conditions come in as well. So how do you work with the employers or employer-assisted programs? How do you work with them so we can be able to give them the support they need at work while also helping them walk through this journey?
Thank you, Doc, for that question. And I think it's quite important because, again, remember, we are looking at functionality. Functionality. And the person who might be having a chronic illness could be an employee somewhere. And the chronic illness can impact the output.
Yes.
They may not be able to work optimally, and EAP now becomes very important, employee assistance program, and this is something that I recommend that HRs in different organizations, they just put in place. So this is just a specialized kind of support to employees, depending also with the need that is there. So for organizations that have employee assistance programs, so you find that if you have a chronic illness and you have that kind of a support at workplace, so the most important thing is that just open up about it, because remember here you are looking at support.
Yes.
So that now you don't get to a point where now you are getting warning letters or show cause because you have not been able to do what?
To do your work.
To perform. Yeah?
Or you've taken too many days off because you're going for treatment.
Yeah, sure. Yeah, because again, this chronic illness requires maybe frequent visits to the doctor, to the psychologist. So just discussing, your chronic or your condition with the management, and just also letting them know the kind of support that you need. So the kind of support that you need could be maybe time off. Maybe in a month, I'll be taking some 2 days off. Or maybe in a month, this is what will be happening. I need to be attending my therapy. So, and I'm sure, we are human beings. If you can be able to discuss that and they are aware and you have all the documentation that is needed, then you will be able to get the support so that in case, something is not okay, then at least they understand. I remember there was a time I was working with a certain client who had a mental issue, and I just advised them. We had a talk, and it's like, because this mental issue was actually making her to take so many offs at work. Just talk to your line manager, just talk to the HR, because they had the EAP, so that they are aware of what is happening. And in fact, from that time that this person talked with their employer, the kind of support that they got was marvelous, and it really helped them to ensure that they are continuously working, and they didn't feel like they were stigmatized. But again, you don't have to tell everyone.
Yes.
In the workplace that this is what is happening.
This is what I'm handling at the moment.
Yeah, just also talking with the relevant person so that you can be able to get the support that is needed, so that your functionality can still be there, and you get the support. So that becomes very important.
Very important. But I think as we do have structured like support EAP programs, like when it comes to mental health, but I think this can also roll out to other conditions as well. Let's say maybe you have diabetes and you need the insulin, or maybe you are on some medication at a specific time of the day. You can actually have the same way we have like lactation rooms in some employment places. You can have a safe space where you can be able to keep your medication, because you need to maybe keep it in the fridge. You can also talk to your employer about this as well. Guys who are having like chronic back pain, or maybe you have some type of arthritis that is impacting how you're working with how you do your work. If you can't type it out, maybe because you have carpal tunnel syndrome, then maybe you can do voice to speech. You can talk to your employer to be able to give you some other accommodations that can work for you at the workplace. So I think accommodations come in broad variations and needs to be tailored to your situation as well. But it's always important that you can be able to speak up when you need the help you need, because as Sylvia has said, it's okay to be vulnerable, and we all find times when we're vulnerable and we need help. But all this times you need to be able to know when to ask, who to ask, and also how to ask. So you're not asking where a time you have like 5-6 warning letters, and that's when now you're disclosing. Then they may be thinking, it's an aspect of you're just speaking up now because you are in trouble. But I think in terms of chronic diseases, we have talked a lot about mental health and cancers as well, because they're the ones that tend to be mostly in the forefront. We have a lot that usually can be presenting with, with pain. And you can find sometimes you're doing pain management, it's not working. You're being told, try the yoga, practice mindfulness. And sometimes you really don't know what this mindfulness means. So maybe Sylvia can help us unpack mindfulness, because child patients, you're going under stress, practice mindfulness, meditate. What does this actually mean? How can we be able to meditate properly and get the full benefits?
Yeah, thank you for that question. Yeah, so sometimes in life, I think it's good when we have also time just to reflect about our life. Just embracing time with yourself. For some people who are extrovert, that can be
a bit
because they like being around people. But just practicing that aspect of just being with yourself and with your thoughts.
Yes. Yes, I think people don't want to be left alone with their thoughts.
With their thoughts.
We want to be on the phone, finding everything else. So you
Yes.
don't want to sit in and listen. We don't even have that. I think we've also almost forgotten how to listen to ourselves.
Yeah, true. And there's a certain client who told me, Sylvia, me, I fear my thoughts, and the more you fear, the more you run away from them.
Yes.
And you see, it will still be there.
Yes.
It will still be there. And in fact, the quality of your thoughts determines the quality of your life.
Very important.
What am I thinking? I'm dumb, I'm not good enough, I'm going to die.
Yes.
And the more you think about that, the more it becomes a reality. The more you become anxious, the more you feel like you don't want to be around people. What are you thinking? Because again, some of these thoughts may not be rational.
Yeah.
Some of these thoughts could be coming from social media spaces, what we are reading about our illness. It is like, now, I have a few days to live, or I'm not going to find a partner, or just depending on what, or maybe I'm not going to have a child, or depending on what you're reading and what have you.
And
so
what the algorithms have sent your way.
Yeah, sure. So you find that now there's a lot of negativity that is actually doing what? That is actually, you're having, and that negativity is what is impacting the quality of your life. Because the quality of your thoughts are not
Where
okay.
they should be.
Yeah, so I think now with mindfulness, sometimes you just also want to analyze, is it true? Is it rational?
Very important. You stop and think, is what I am saying true?
Yeah, is it true to myself? Is it true that I'm not good enough and I'm still working? Maybe I'm a manager in a farm, is it true what I'm telling myself? Yeah, and sometimes if maybe you are not able to do that, or maybe if you don't know how to do the mindfulness, you can also just speak to a psychologist who can also help you to just unpack some of those thoughts that you have, and just also to teach you how you can be able to do that. But again, just also having that moment with yourself where you can reflect, you sit with your thoughts, can really, really help you to understand how these thoughts are really impacting the quality of the life. Yeah, because again, when it comes to chronic illness management, our main focus will also be the quality of life.
Yes.
And it's also good to just ensure that we can still be able to live a fulfilling life despite what happens. Yeah, because again, life happens, some things that we have not planned for, and those things now require change. And just embracing a new normal, a new way of doing things becomes quite important, rather than just sitting with a lot of negativity. Yeah, so I think mindfulness becomes very important.
But I think also one very important aspect of managing the chronic disease, you mentioned it's a new normal. But I think also as you're working on the new normal, it's always very important to have goals. So let's say maybe you have hypertension, your blood pressure is very high. Have a goal in terms of what's your next target for your blood pressure. If you're diabetic, what's the target for your blood pressure? Your blood sugar. If maybe you are unable to do you're told to start an exercise program, have a target. Where do I want to end up by X? Make it really a smart goal. Have like a time frame of when you want to get those things. So then at least you have something that you're looking forward to and you're working towards, as opposed to just taking medication every day. Now just take a medication, you start saying, oh, the doctor will know what my blood pressure is. No, take ownership of your health as well, because you can know I am working from A to B. And also, as Sylvia has mentioned, when you practice the mindfulness, when you sit down by yourself looking at your blood pressure reading, and then now the thoughts come in, then you'll actually know, okay, these thoughts are a bit too negative. I need maybe now to seek help. Because now there you have that insight, you're seeing, okay, things are not as positive as they should be. Yeah, but I think it's very important to realize that physical health, mental health, emotional health, they're all these well-beings are all interlinked. We cannot be healthy without being mentally healthy. And also there's a very important phrase I remember saying that, you can have a mental health disorder and you can be mentally healthy. But you can think you do not have any chronic condition or any disease, but you're mentally unhealthy because of how your mental well-being is going along. So it's very important to just have goals and focus and figure out how to get to managing these chronic diseases. Yeah.
Very true. A lack of diagnosis doesn't mean that, you're okay.
Yes.
You may not have been diagnosed with anxiety, but
You are constantly sweating.
Or maybe your mental health, the way you do things, will actually lead you to that, you developing the anxiety. Yeah, so I think from this discussion, what I'm getting is that it is quite easy for someone to have more than two conditions because of not managing the other, the aspect of comorbidity.
Yes.
So because of diabetes, now I'm having anxiety and I'm having, and I think now to reduce that, that's why now the multidisciplinary team need to come in. Because again, you might be having something, and if you don't cope with it well, you now start developing another problem. Or maybe because of my depressive aspect, I start using alcohol as a coping mechanism. Before I realize now I'm having another problem, alcohol use disorder. And you see now, you can imagine now if we have to manage two conditions, you see now it also becomes complicated. And that's why it becomes very important for us to ensure that we are able to focus on all those aspects so that the prognosis can be much better. But there's also another group that is also normally impacted by chronic illness, and those are the caregivers.
Yes. It's not a very easy task being a caregiver.
It's not very easy.
Yes.
Sometimes they also get depression, anxiety.
But you might find when they're doing the consultation, they will take the patient for the consultation and end up forgetting themselves. And they know that there's another group that's at a very high risk of burnout. And then you start feeling guilty because I'm taking care of my mom, or maybe I'm taking care of my husband or my child, but I'm feeling like I'm dissociating because I'm having burnout, because I'm constantly, putting myself behind, putting them at the forefront. So how do we support the caregivers a bit more in maybe the same consultation, because they can't have two consultations? How do we support the caregivers of these people with chronic diseases? How do we support them?
So even with the caregivers, what we normally do, we also try to explore just the dynamics that are there, and the kind of support and even what they are doing themselves, because some of these caregivers, they could be employees somewhere, their wives, their parents, but they're also taking care of the patient here. So what we normally advise is that, yes, as a caregiver, if you can also get support, the better, so that you don't have to do everything,
by yourself.
Because again, sometimes the patient might just want this caregiver. But again, you see now when we come in as psychologists, we can now try and also see how we can manage that. We talk to the patient, and also we talk to the caregiver. Because again, now once you get burnout, it means that you may not even be able to do it. To take good care of this, patient. You will start becoming angry. So you find that now you'll be projecting your emotion
to the patient who you're supposed to be taking care of.
Yeah, then it complicates things. So you find that it is something that we really need to look at holistically. So we don't just focus on the patient alone, but we also try and look at the caregivers and the support that is there, because I believe that you can't help someone unless you're also mentally okay.
You can only put the mask on somebody else after you put your own oxygen mask.
Sure. So that also becomes very important, especially in the aspect of chronic illness management. So I don't know if we have questions online from our viewers.
How can I stay motivated when managing long-term conditions?
How to stay motivated?
How can I stay motivated while managing
long-term conditions?
Long-term conditions. So in this case, what I can say is, first of all, that aspect of acceptance. Acceptance doesn't mean that you're embracing, now you are saying that now I'm going to be vulnerable and what have you, is now looking at now what is the new normal for me. You understand? Because things happen in life, and change becomes inevitable. I just need, first of all, to accept. So what does this mean to me? Do I need to change my goals? maybe I used to do this and this, but I'm not staying away from it, but maybe I just need to do or to divert a little bit. So the thing here is, first of all, I need to accept and I need to understand what this chronic illness mean to me as a person, and maybe just adjust my goals if I have to. Yeah, and of course, if I adjust my goals, then they'll be realistic. Because again, if I'm having a chronic illness that requires me, that makes me not to be mobile, and I still need to do things that I need to move around, you find that I'll lose a lot of hope. So maybe if I can be able to have goals that I can still be able to do while I'm still, when I'm still confined somewhere,
limited.
yeah, then I'll be motivated to just do things. So it's just a way of finding a new normal. But again, there's something that I also say, support group. Having a support group, because again, when you have people who have gone through the same condition, they can share their stories on what they have been able to do, how they have been able to maintain, their lifestyle, and that can really encourage you. So don't isolate. So maybe what I can say, when you have a chronic illness, just come out, just speak about it. Don't isolate, because again, when you come out, then you will be able to see people who have actually gone through that and they have been able to do things differently.
Yeah.
How often should someone with a chronic condition go for review or follow-up?
I think the frequency of when you're going for review or follow-up depends on what condition you're having, and also what your management plan is. So you can find in the initial stages, once you're first diagnosed, there's a lot of your consultations tend to come in a bit more frequently. So you can find you can be going in every 2 weeks, every 1 month. And then as you progress with the condition, as you more are able to take control and it's being managed, it can end up being every 1 month, every 3 months, every 6 months. We have people with some chronic conditions who are maybe on follow-up every year. So it depends on your condition, where you are in the stage of diagnosis, and also the plan that you have with your doctor. So it's always very important to have discussed with your doctor, this is my condition, what is our plan? What is my plan as Njeri? What is my plan? Where are we going? What are my targets? And just have a very open discussion in terms of where you're going with your treatment. From there, that is when you can be able to know how frequent your consultations or your reviews will be. But generally, you can find the longer you have a condition, the more spaced out your consultations or your reviews will be. But it also depends on diagnosis, how long you've had the condition, also how your condition is responding, and a whole multitude of factors. But yeah, it can vary from person to person.
What are some early warning signs that a chronic condition may be worsening?
So normally how you can know your chronic condition is worsening, it again, it depends on the condition. So we can take something like maybe hypertension. So for hypertension, when you're once diagnosed, the goal is to prevent you from developing the complications of the disease. So there's a follow-up that you'll have in terms of having your different organs checked, so your kidney functions checked, your cholesterol checked. So with those checkups is when you're going to find out that there's a problem coming up, and that's when it's managed. Some conditions may also be silent, so you will not know that things are worsening until it is too late. But generally, how you feel is always very important to just have a discussion with your doctor. You say you start feeling a bit of fatigue, in case maybe you start having a new symptom, it's always very important to have a discussion with your doctor. In case maybe you find like maybe you are having back pain, your condition involves having chronic pain. If the pain is getting worse, you're taking your pain medications, you realize, I need to take more pain medications to manage the pain I was having, then that is a new symptom or a worsening symptom. It's always important to just raise it up and have a discussion with your doctor. So early warning signs would vary from person to person on your condition, but if the symptoms you are having, either maybe they had resolved and they recur, or they start being worse, or they start persisting, or you start having any new symptom, it's never, I usually encourage patients that keep asking questions. If you have something that you're not sure about, ask your doctor about it. Then they can be able to decipher whether it is linked to your condition, or is it maybe you're having maybe something acute, or maybe it is something totally new. So always ask questions, and if there's anything you're not sure about, always inquire. But the symptoms can vary from person to person.
Why do some patients struggle with medication adherence or lifestyle changes?
If I can that, for some, it's because they have not accepted their condition. They are still in denial. Or for some, it could be there are some side effects of those medication. So maybe I'm taking this medication and I'm realizing I'm becoming bigger, or I'm sleeping too much. Yeah, so the side effects can also impact. And that's why, even as the doc said, it's always good to just go for reviews, and so that you can be able to discuss with your doctor what is happening.
I think also another aspect of adherence that comes in, you mentioned acceptance. Another thing can also be, you just simply have forgotten your medication. It happens a lot to some of us. So I think another thing that can also help you with adherence would be having medication reminders. So having maybe an alert on your phone. Some people have like little gadgets they put on their pill bottles so that they can remember that they've taken the medication. Because another thing can happen, your adherence can either be you've forgotten the medication, or you can actually end up taking double the dose because you forgot you took your medication and you take another medication again. So they usually have some also pill reminders that can also work in that. But I think the biggest percentage of it is usually because of acceptance and also not having structures in place. Also, another thing that also used to work a lot in the HIV sector is having a treatment supporter. So if Silva is my treatment supporter and I've come to work, she'll be like, oh, have you taken your medication this morning? So having a treatment buddy or a treatment supporter is also very important in terms of medication adherence. Yeah.
Why is continuous care important?
Continuous care is important because we are managing a chronic condition. A chronic disease, by definition, is something that has no cure. For some, I will mention that you can't go into remission, right? Especially for cancer, we'll mention that you've gone into remission. For diabetes, you can also go into remission, but that's usually very specific for specific patients. But even when you're in remission, you're not cured. So we'll still have the follow-up, the continuous care. It might end up being like maybe once a year, once every 2 years, but there's still always that follow-up that will still continue. So continuous care is just also to just prevent, you have found, yes, you have one condition. As we've mentioned, it's also about a holistic following up of the patient. So we're trying to find out, are you having any other comorbidity? Are you suffering in any way? Are you struggling with your medication? Are you having maybe challenges in terms of side effects? So that's why continuous care is very important, so that we make sure you're on the right medication for you. The medication is working appropriately the way it should be, and that we're preventing you from having what you call the sequelae or the complications of the disease you're having. And so we can also make sure that something that Sylvia has mentioned that is very important, that the quality of life you're living is good. Yeah.
Yeah, and something else also, especially in the area of mental health, relapse can happen. You are treated for depression and, you are functioning well. But again, something happens, a trigger comes, and then you relapse. And it becomes quite important just to continue with care. So relapse also do happen.
So final question. What is one thing someone living with a chronic condition can start doing today to better manage their health?
I think in terms of one thing that you can start doing today is exercise. And by exercise, we don't mean go out for a run, go for a walk, go out into nature. So exercise can impact your mental health. It improves your cardiovascular health. It helps you sleep better, which usually is a complication of a lot of chronic conditions because, you're stressed, maybe the medication are making you stay awake longer. So one thing I think I would advise from my aspect would be exercise. Try and have an exercise routine. It could be something as small as going for a 10-minute walk at lunchtime if you're able to walk. If you're not able to walk, do the exercise that can work within your limitations that you have based on your physical condition. What about you, Sylvia?
So something else, just also going for full body checkup.
Yes.
I think it's important. For some people, they could be having insurance, but they have never gone for full body checkup. Yes, just to know if there's something, because again, full body checkup can also help you know if there's something that has started to develop. Or maybe if all is well, then you just now continuously, as the doctor said, doing some of those exercises, healthy diet. And sometimes even just having a conversation with a doctor or a psychologist, they can give you tips on what you can be able to do to ensure that you can become healthy, or you can avoid some of these chronic illness, because some of these chronic illness are as a result of lifestyle. Of course, we know there are those that are genetic in nature, but there are those that comes as a result of our lifestyle. If I'm a chronic alcoholic, then the chances of me developing certain problems related to that alcohol then is actually high. So I think also just having a conversation with a professional can also help you to know maybe certain risk behaviors that you need to change, and so that you can avoid this chronic illness, especially those that are brought by lifestyle. Yes. Yeah, so maybe my closing remark is, chronic illness is not a death sentence. Yeah, so you can still live with a chronic illness if you know what to do. So just talk to your doctor, talk to your psychologist, and then you can be able to discuss the management plan. But above all, remember that you also need to take active step in managing your condition. So chronic illness is not a death sentence. That is my closing remark.
I think for me, it would be, as Sylvia's mentioned, it's not the end. And also, as long as you have a plan and you have a place where you're going, you know where you're going with your management of your condition, then you have something to look forward to. My other second final point would be, talking to a psychologist does not make you lesser or make you less of a human being. All of us at some point need to actually talk to a clinical psychologist. So if you feel you do need help, you need a bit further assistance, maybe the medical aspect, your medical treatment, you're on point, everything else is going okay, but you need some assistance, some little help in terms of managing more of your mental health aspect, talk to a clinical psychologist. It will really do a great impact for your overall well-being, which is what is very important. So thank you all for joining us today as our team, as we're discussing chronic diseases and mental health. In case you have any questions, any queries, feel free to reach out to us on our social media platforms. We are available 24/7, so feel free to reach out in case of any queries or any concerns, or maybe you have any other topics you want us to cover or any other discussions you want us to have with you.
Yeah, thank you all for joining us, and we look forward to seeing you again in our next live webinar. Thank you.